Apparently, in the old days, when you called a doctor, a man, usually a man, would walk up to your door and knock on the door, and they'd have a big black bag full of mysterious items and always a stethoscope around their neck. And they would come in and listen to you and talk with you. And they'd already know a lot about you because they just lived down the street and they'd already been your doctor for years and years. Maybe they'd even delivered you when you were born. And then they would give you some advice and maybe some medicine, and then they would be on their way. And that's how family medicine used to be practiced. Or maybe you'd come into their office if it wasn't an urgent thing or you weren't feeling so bad, but it would still be based on a relationship, based on trust, and not hurried, not rushed. And now we're left with this current healthcare system. And a lot of direct primary care, DPC, is trying to go back to the feeling of that old way of practicing medicine. We do home visits. I got to go to a patient's home and help her get squared away after she really hurt her knee and really couldn't go places. That was a good experience for both of us. That was just recent. It's a shame what healthcare has turned into, but a lot of people that I talk to about direct primary care are nervous about it because it's different. That makes sense. Direct primary care is something that hasn't been seen in a long time. When was the last time you heard of a doctor that could come to your house? What? That doesn't happen. But even though direct primary care has a lot of new things to learn about, which I am happy to sit down and talk with you about, answer your questions, go to our website, PineRidgeFamilyMedicine.com. It has a frequently asked questions section that I wrote, and I feel like it really addresses a lot of the concerns about direct primary care. But there's a lot of inconsistencies with what we put up with from our current healthcare system that are also completely left up to the imagination, that you don't get to have straightforward answers on, that we put up with. So, for example, even something like, what will this visit cost? Can you imagine sitting down for a nice steak dinner and them serving you your steak and you ask how much it will cost and they say, you'll get the bill in a couple weeks. And you have a clue how much it will cost. Is this a $20 steak or is this a $100 steak? I have no idea. And that's even worse in healthcare because the prices can just be exorbitant. I mean, they can easily go into the thousands of dollars for procedures. But that's what we put up with from our current healthcare system. How is that okay? That's one of the things I love about my practice, is that I can tell a patient, hey, I happen to have this medication on hand in our own little formulary that we have here, and this is exactly how much we'll charge you for it today. Wow, what a surprise, as opposed to, hey, here's a prescription for this medication. Go to the pharmacy, and between your insurance and the pharmacy, they'll tell you how much you have to pay. And it might be hundreds of dollars, but you need to take this medication. It really makes you wonder, how much do I really need to take this expensive medication if no one even knew how much it would cost? So that's a big one that sticks out to me as an unacceptable aspect of our current healthcare system. But especially if you have a last-minute appointment that you really need to be seen for, you're worried you have strep throat, and before you go into work and pass it to everyone else, you need to be evaluated for that. You go in to see the doctor, you're not sure who you're even going to see a lot of the times. Is it going to be a doctor? Is it going to be a PA or a nurse practitioner? Is it going to be the nurse? It's all sorts of different options, and you don't know for sure. How are you going to have confidence? Do you have a relationship with that person? And when you're signing up for that doctor, I've gone through many websites for doctors in my day and tried to pick out a doctor that I'm going to click with. But that isn't always a good way to do it. What are the special interests of my doctor? Am I a guy going to a doctor who really specializes in women's health? Am I a woman who's going to a doctor who only really likes to work with prostate issues, and that's the area that they're most interested in? I'd like to know those kinds of things. Am I going to have even hobbies in common with my doctor? Can we talk about gardening after the visit? I have a couple other fellow beekeepers in my practice, and that's always fun to get their hints based on the weather of what they're doing with their bees at the time. As silly as that can be, or as serious as it can be when it comes to you have a special medical condition and you need someone who really knows about it. It's nice to know. And along those lines, sometimes you have very personal things that you need to talk about with your doctor. I try to talk about some of those on this YouTube channel so that you can be more at ease when you go and talk to your doctor about those. But when you go in for those exams, not all doctors are good about communicating how thorough this exam is going to be. Is this going to be us just talking about my symptoms? Or are you going to need to do a much more invasive exam? Am I comfortable with that? Do I know you well enough to trust you to do that exam and keep me feeling comfortable? That's not something that you see all the time in our regular healthcare system. And then you get your blood drawn, you get your x-rays done, and then you wait. Are you going to hear back from your doctor? Are they just going to say no news is good news? Does that mean that your doctor never ever forgets to call you about lab results if they're bad? Do you really want to put your health on the line, trusting that your doctor is always going to stay up on top of every single important lab result and every single image? I know that as a doctor, I am not willing to accept that responsibility. So if my patients don't hear from me, whether it's good or bad, completely normal, or something very worrisome, if they don't hear from me, they need to contact me because I want to contact them for every single lab result, every single imaging result they should hear from me on. That's the only way that they know for sure that everything was okay. And that's something that I would expect from my doctor. But so many people don't. So many people are told the line, no news is good news. Ugh, that drives me crazy. What about how your doctor makes decisions? I mean, there's big flow charts that were given in medical school on do this next, after this, and this next, and then this. And sometimes there's just branches of try this, or and there's no guidance given as to which one to try first or last. So how is your doctor going to make those kinds of decisions? What are the priorities of your doctor one way or another? And are they being influenced by insurance or by money? Are they being pressured by the healthcare system that you should really do this before this, even though it might not be in the best interest of your patient? You deserve to know those kinds of things. Whereas in direct primary care, the money from the patient for their monthly subscription goes straight to me. There's no insurance middleman. There's no one else I'm getting amounts of money from at all. So my interests are purely to take care of my patients, to keep them alive a long time and healthy and happy with our relationship and with their care. I think that that's the way your relationship with your doctor should be. I'm working for my patients and no one else. What about when you do have an urgent question for your doctor and you email or call or text, if you can text, your practice? Who's getting back to you when you get that anonymous text message back? Is it really your doctor? Is it someone else? Is there another doctor covering for your doctor while they're on for the call week? Is it a nurse who's getting back to you? That's not always clear, but we put up with that. And what about if you have, I know I like to look back on my old labs from years ago or my kids' results from years ago, their growth curves, and reassure myself that things are going well. But if you have no way to access the system or you have this complicated login that you have to remember, that gets rough. So with my patients, I send them a copy in PDF of all their lab results, of all their imaging. If they want their growth curves, I try to print off the growth curves every single well child visit so that they have that on their record. But if they need another copy, I can always email it to them. That open communication is so key. I really feel like there's a basic lack of respect and communication between most doctors and patients these days that I think is really unacceptable. Appointments are rushed, communications in general are rushed, and that there's other priorities to employers or to insurance companies or to healthcare systems that get in the way of that relationship. And I think that's enough. Don't put up with this anymore. Go find a direct primary care practice in your area. If you're in Colorado Springs, come see us. And stop putting up with these unpredictable aspects of your healthcare that might be putting you in danger. Thanks for watching. If you want to learn more about direct primary care, I've got another video by Dr. V up there. And please subscribe to our channel here so you can find out more about us. Thanks for watching.